Let's move on to our last session. This session is about nuclear and radiological disasters and traumatic and explosive events. Let me invite our speaker for this session. He is the Assistant Professor of Emergency Medicine in Believers Church Medical College Hospital, Tiruvalla. He is also an advanced satellite life support instructor. Dr. Jobin James, over to you.
Good evening, one and all. Thank you for those warm words. So without any further ado, let us stick to time and we'll move on to our next presentation. So what we have heard right now from Montesa after the experience in MSF, I think it was all there over the news during that particular
audio is not so clear.
Hello, am I audible right now?
Much better.
Hello, am I clear?
Yes, sir.
Yeah. So without any further delay, let's go jump straight to our topic. Now, our earlier speaker, Dr. Murtaza, talked about his experience in Iraq with MSF. So we all know what kind of injuries most of them are undergoing through. It is usually a traumatic and explosive events. So in this talk, we'll be trying to deal with two topics. That is one, nuclear and radiological emergencies, and the other one, the traumatic and explosive events. Now, from the earlier session by Dr. Jeffy, he said in a definition, the main operational definition of a disaster. If you forget the big definition, remember the simple definition. A disaster is termed when the needs are greater than the resources. So when the needs of a particular place outweigh the resources, it becomes a disaster. And this is very much what was of extreme importance or more critically involved when there's a nuclear or a radiological disasters. I know we all are in different streams and chemistry is not a strong subject for many of us. I mean, some of us like us, some like me do not. So before we go into nuclear and radiological disasters, it's important to understand what are some of the basic concepts. So over to a little bit of basic chemistry. So we know from these radiation basics that there are 4 types of particles released during any radiation. So there's alpha particles, beta particles, gamma, and neutrons. And these are the 4 ones that we will try to explain shortly. So alpha are the first type of particles which are released during any radiation, and these have an extremely short range. The more important point being that they cannot penetrate the outer layers of the skin. Whereas on the other hand, when you're talking about a beta wave, they have a little more range. So they are a bit harder to shield, but they can be shielded by means of an aluminum foil or something like that. But it causes some damage and it travels only a short distance. Whereas whenever you're talking about, especially any nuclear or radiological disasters, the main waves that we are concerned about are basically our gamma waves and the neutrons. So gamma waves, as you can see, they are very difficult to shield against and can penetrate very well into the tissue. And these gamma as well as neutrons, on the other hand, they penetrate well and they make those particles such as metal, soil, rock, all of them more radioactive, thereby emitting more beta and gamma radiation. So from these simple slides, you could have understand that beta, gamma, and neutrons, they penetrate the tissues to some extent in various degrees. And these can cause various kinds of DNA damage, cell death, and cause various effects to the body, such as radiation sickness and all those other things put together. So this is a summary of what we were trying to say. So alpha, beta, the X-rays, the gamma, and the neutrons. So you can see the penetration with the level of each waves. And the ones we are more concerned about is gamma and the neutrons, which are especially released during a nuclear and a radiological disaster. Now, what do you mean by a radiological disaster and a nuclear disaster? Both are completely different terms. So let's put that, that's the first thing to be put across. So when we're talking about a radiological disaster, it is where radiological activities are released into a particular area, but there may not be, or it is usually not associated with a nuclear explosion. The main purpose of a radiological event is basically in order to create fear, panic, and contaminate the area. Human injury might be there, but it is not necessary. Now, when I say this, it seems like, okay, I don't get a picture of what it is. So best example is, the best way to realize this is by, if you have watched several Hollywood movies, you know where I'm going along with this. You have heard about this term such as called as a dirty bomb. So what is basically a dirty bomb is something like, you have heard of a dynamite. So within the dynamite, they put inside radiological substances. This is called as a radiation dispersal device. So when this dynamite explodes, the radiological substances within it also gets released. They become into the radioactive form and they also get released. So there is effects of both of them put together. That is the effects of the explosion of the dynamite as well as the effects of the radiological component. So this is called as a dirty bomb. So what happens is, imagine there is a dirty bomb or a radiological emission device there and it has exploded. So from that dynamite, from the expulsion of these particles, anyone in close proximity will get injured and might even suffer serious injury. And because of the radiological substances in it, these gamma and beta, gamma and the neutrons can penetrate in the tissue, thereby causing radiological injuries. But as you can see, these are smaller detonation devices. So these are not like our nuclear disasters that we think of when we think of, say, Hiroshima or Nagasaki. So they may not cause that kind of a disaster, but these are very extremely effective in creating panic and to contaminate the area. So what would you do when you hear that there is such a radiological disaster? The first thing is to get inside and go to safety. As we said, radiological disasters are smaller scale disasters. So the penetration of the waves may not be, so our primary objective is to hide in the safest area possible and stay inside and stay tuned to the most reliable sources. They always say during a time of a disaster, listen to national telecast radio or national televisions. It is very important not to create more fear, more panic, and to prevent misinformation during such crisis. Whereas what about a nuclear event? When a nuclear event happens, that is what we think of when we say Hiroshima, Nagasaki, any nuclear explosion, where the main components, there is a massive explosion where there is a huge amount of radiological material that's being propelled out. So what happens is there is a shock wave, massive amount of radiation that goes around, and this can, because of this radiation, the radiation is a main component there, and that radiation itself can cause severe radiation sickness, thermal burns, and various other injuries. So if I'm trying to summarize it into it, we can say nuclear events involve a large scale of deaths and large scale of radiation exposure, whereas radiological events are much smaller. So this is the basic way of as to how I can differentiate between a nuclear disaster and a radiological disaster. So from this, you can understand whenever there is a nuclear explosion or even there can be trauma, there can be burns because of the thermal heat component, there can be burns, there can be radiation injuries, and there's something called as electromagnetic pulse. What is electromagnetic pulse? When there is a radiation explosion, what happens is there's a burst of electromagnetic waves that are released, and that can completely cut off your electromagnetic grid. Therefore, you might lose your Wi-Fi connection, your electricity, all those things are being cut off. This is called as an electromagnetic pulse. So what should you do whenever there is such an incident? It's very important to look at scene safety. As mentioned here, any disaster, ensure you are safe and everyone is safe. So ensure your safety first and look at security. And then it's very important to wear certain equipment such as personal protective equipments. So these will allow you to prevent the exposure of such radiation. And then radiation exposure monitoring and casualty decontamination. So when any such nuclear or radiological disaster happens, there's going to be a disaster team that is going to come to the area. And what are they going to do? They are going to see which is the area that's involved in the radiological disaster, and they will try to identify what kind of radioactive substance is involved, because that can give an idea of what is the range of which it can go and how it can affect various human lives. So again, this is beyond the scope of our topic today, but this is what usually happens during a disaster setting. So when a nuclear event happens, as you all know, so lots of people are going to die at the center of that explosion, and around the peripheries, there's going to be a lot of mortalities and significant casualties, and they need to be managed actually quickly by means of a mass casualty triage, which we'll be discussing in another lecture. And another issue with all these radiological issues, whether it is nuclear or radiological, is going to be acute radiation syndrome, where because of these radiations, since they penetrate the tissue, there is going to be multi-system disorder where it can involve all the cells and it can undergo cell death. That is called as acute radiation syndrome. Now, what are the public health implications? As we all know, it can completely crumble the economy of a particular country and even its resources. So there is going to be emergency crisis. It can cause severe physical rehabilitations as well as mental and behavioral considerations are to be considered. And at-risk population are the ones who are going to be most vulnerable in any disaster. Remember, in a situation of a disaster, the most vulnerable people are the old age people, the pregnant women, the women, and children. So they are the ones who are going to be more severely affected during any disaster. I'm pretty sure all of you must have heard of the Chernobyl disaster, and this is a classical example of a nuclear disaster. If any of you have, if any of you have not watched the series, please do watch it. It is there in Netflix and other series streams, and it is an excellent stream to actually teach you what are the effects of a nuclear disaster. The other topic we'll be dealing, which is somewhat close and similar to this, is a traumatic and an explosive events. Explosive events, what we usually mean by, say, for example, a nuclear event is a type of an explosive event, but when we are trying to talk here explosive, we mean a bomb attack. And India is not naive to it. We know that there are bomb explosions several places. Now we know there are places which are undergoing war, such as in Israel, Palestine, or Ukraine, Russia. So you can imagine the amount of explosive events that are happening in that particular community. So what do you mean by an explosion? So imagine there's a bomb and it explodes. So what happens? When there is an ignition or a spark, inside there's a rapid increase in the volume within the bomb and it releases that energy. And that energy is being released at such a high temperature that there's going to be waves and that is going to explosions. And there are different types of explosions. There can be supersonic and subsonic, depending on the speed in which these shock waves travel. So imagine this is a bomb. The bomb has burst. So what happens is there's ignition there. So that is called as the incendiary thermal effect. Because of that thermal effect, there is going to be a blast. And the first thing is that huge pressure is going to be released in the form of a blast pressure effect, or it is also called as a blast wave. Yes?
Sorry to interrupt. Can you be a bit more louder?
Yeah. Sorry. So there is going to be an initial ignition, and this ignition, because of this ignition, there is going to be a blast, and there is going to be a blast wave. And this wave is going to spread rapidly. So what happens is this effect is called as a blast wave. And as the blast wave progresses, you can imagine that wave carries along fragments of the particles that are going along. So depending on where you are standing, you can have different kinds of injuries. So remember, in a blast injury or in an explosive event, there are three types of injury you have. There is something called as primary blast injury, which is basically injuries due to the blast wave. So when there is a bomb, the bomb has exploded, there's a blast wave because of the pressure. Because of that wave, whatever injuries you suffer, that is called as a primary blast wave. Now, because of that wave, there are going to be particles also which is going to go along with that pressure. Because of those particles, when you suffer injury, that is called as a secondary blast injury, which is due to the substances that are being propelled by the blast wave. And the last one is a tertiary wave. As the wave touches you, you are also being carried away by the wave and you will go and hit somewhere, maybe the car, a building. So the injuries you suffer after you get impacted on another object, that is called as a tertiary injury. So this is a real video. I hope you all have seen this happened 4 years back in Lebanon, in Beirut, where there were several tons of ammonium nitrate in the port of Beirut and it exploded. Now here you can see the intensity of a explosive event. If you can see here, somewhere there was the explosion. You can see the explosion there. Once the explosion happened, what you are seeing outside is called as a blast wave. And you can see as the blast wave is progressing, it is taking out all the particles, destructing every single piece. And those particles which are actually coming out from these buildings, those are the bullets or the propels. So you can see if someone is staying close to this blast, you are suffering first injury, a secondary blast wave because of the particles released from this. And because of this wave, you also get pushed and you suffer a tertiary injury. To see another impact of how these waves are clearly visible, this is another example. You can see the explosion, the blast wave, and the particles. You can see the cameraman went behind. That is because of the wave pushing you back. So what he suffered is a tertiary wave. You can see the particles also flowing towards him. So this is a good example to illustrate you, to show you the effects of a blast explosion. As you all know, several hundreds died. And after this single incident, imagine Lebanon suffered an economic crisis. They had this single event caused them loss of more than 15 to 20 billion dollars, and they have been in economic crisis ever since. So to summarize the kind of blast injuries, you have the primary, the secondary, the tertiary. These are the three main kinds of injuries that you have from a blast. What are the quaternary? Quaternaries are the events or the injuries that happen after the disaster. So other explosions such as injuries, illnesses. So after you get these wounds, you get a superseded infection. So all those things can be, that is called as a quinary infection. Again, not to stress too much on it, but the more important points are our primary, secondary, and our tertiary injury. So whenever there is a disaster that strikes, whether it be a nuclear or a radiological disaster, as well as a traumatic and an explosive disaster, it is always important to approach any disaster in the form of a pre-disaster paradigm. I think Dr. Jeffrey has summarized it quite well in a concise way. So again, so what do we mean by, how do we assess this in a pre-disaster paradigm. So the best way to example is every government should know or should at least plan adequately well in order to prevent such attacks. Best example, when I gave the example of Lebanon, remember in the port there were ammonium nitrate, more than 2,000 tons of ammonium nitrate was in the port of Beirut. So they realized that this could have been avoided if those were actually segregated and put in a separate area. They were all put together. So that is why the PRE plays a very important role before the disaster strikes. A proper planning and practice, a proper planning of where things should be. Resilience is the ability of a community to overcome the disaster. So that is where the role of mock drills happen. So if a disaster happens, we should be able to know, okay, what should we do next? If we are not trained in it, it will be fully chaos and we'll be running left, right, and center. And the other one is proper education and training. This is where conferences, workshops, and all and our mock drills and all help. And this is what we are trying to teach you by means of our United course, where courses such as health and our mock drill, we are trying to educate and train what would happen and what is the outlook or what is an idea of a disaster and what should we do in the event of a disaster. How can we try to minimize the effects and how can we help to better treat and better deal with such a situation. And the rest is a disaster paradigm detection. This disaster paradigm happens once the disaster strikes, where there is going to be a detection and incident management, where the management will take over the function. Then you will have to look at safety and security, assessing the hazards, a proper support, triage and treatment, evacuation, and finally recovery. Remember, just like how Jiju sir started the topic with the Wayanad landslide, the disaster happened, but the recovery is still going on. The rehabilitation is still going on. It's an ongoing process. A disaster must have happened and it must have gone away, but the rehabilitation doesn't end there. So there's a lot of things to look forward to when you have such a disaster. So these are things that usually happens with an explosion, which again I'm not going, which we all know that once you have a blast injury, you can have different types of injuries. And this is one thing that many people ignore. What about their cognitive? What about their emotional symptoms, behavioral symptoms? They undergo so much of post-traumatic stress disorder. So all those things are to be considered, especially in the setting of a disaster. Now, this is where people suffering from wars or landslide disasters and all those things, they require help. And that is what we'll be trying to focus for in the subsequent lectures and subsequent webinars, and also during our 4-day international conference, which is happening from November 14 to 17. So the floor is open for any doubts or any queries with regard to this topic or anything else. And the floor is open to you all. Thank you.
Thank you, Jobin sir, for the informative session. Dear audience, any questions? You can see a few questions in the chat box. Any questions?
Quinary injuries are basically injuries after, like imagine you have an injury and then you get infections from it. Example, you have an injury, say, for example, a semi-amputated limb, and the patient has come there, you have treated it, and then you get subsequent sepsis or secondary infection to it. Those are called as quinary injuries. That is one of the doubts there. And I think one of the doubts is for Dr. Murtaza. Sir, didn't you get fear to stay in such a conflict zone? So
Oh, sorry, yes. So obviously, good question, because obviously there is fear. The question is, you have to balance out the fear with what you're gaining. At that point, if I made a list of what I was gaining, and I was gaining so many things in that mission, including some peace of mind, I was trying to figure out something in life, and I thought doing something like this will shake me and give me those deeper answers. I had had a breakup with my girlfriend that time, so I was very upset, very angry. I wanted to channelize that energy somewhere. So I think my need to do all of this thing superseded my fear. That doesn't mean that I'm some brave superhero or anything, because today, if you ask me to go again on a mission like this, maybe I won't, because now my fears are more because I've got certain other responsibilities. So the story has changed a bit. So I would say for each person at a different point in life, the fear versus what they are gaining, it's risk versus benefit, how we say, keeps changing. At that point, I was completely fearless and I thought I was gaining more. At this point, it's changed a bit. Having said that, when people ask me this, I was actually working in Mumbai. My medical school was on a highway, one of the most dangerous highways in Mumbai. And if people said, what if something happens to you in Iraq and there's an explosion and you die? I said, what if we are having this discussion on the phone, I'm crossing the road and on this highway I'm dead? So there's no end to what ifs. The chances were reasonable that I may actually die on this silly highway in Mumbai by talking on the phone. So I would rather prefer, if I were to die, at that point I said, I'd rather die this way than that. Usually, very rarely, healthcare professionals are brutally attacked. Somehow the mechanisms are in place to take care of us, if that answers the question. Thank you very much for that question.
Thank you. If any other queries, please feel free to.
Thank you, sir. So let's wind up today's session. Before that, I would like to remind our audience, those who haven't registered yet, that United 24 is our first international disaster conference on disaster management. It's being held from November 14 to 17. We have exciting prizes for the quizzes and poster presentations. We also have the help certification for all the participants who are registering for the United. So thank you so much for your patient listening. So the next webinar is on 19th and 26th of October. We'll be sharing the details soon in the groups. So thank you so much. Good night.
Thank you all.
Thank you.